Young people get vein disease also. I mean, we see patients who are teenagers. Now, I think once patients have symptoms, it's important to address it. Obviously, that's specific to the patient's needs. But one of the things that I think is a myth is that you can wait until it gets really bad and you don't have to fix people when they're younger. But first of all, most patients when they're younger do feel much better afterwards. If we see patients when they're really older and they've already developed a sequelae of chronic venous hypertension where they have swelling, they have skin changes and so forth, we're not going to be able to get them to 100% of baseline most of the time. One of the advantages of treating patients early, before they have a lot of swelling and before it's damaged their lymphatic system, is then we can get them to baseline and they don't have to deal with the long-term sequelae of having chronic venous hypertension.